So everywhere that we've seen philosophical exemptions, we've seen higher rates of outbreak and disease spread. In Washington and New York, where the pockets where these outbreaks happen are pockets where, unfortunately, there's a large group of vaccine-hesitant folks. So we're really looking to get as many people vaccinated as we can to best prevent widespread outbreak.
Right.
And vaccination protects those not only who are vaccinated, but it protects those who have medical conditions that otherwise wouldn't be able to get vaccinated. The very young that are too young for certain vaccines, the very old, also folks that are immunocompromised, folks with cancer that can't get certain vaccines during times of outbreak. So it's really not just a personal choice. It's something we do as a community to ensure that everybody is safe.
And that's what I've read that it's called herd immunity.
Herd immunity.
Herd immunity, yeah.
Yeah. And so to be effective, over 90% of the population needs to be vaccinated in order to stop widespread outbreaks.
Right.
And protect those that can't get a vaccine for medical reasons. Also, no vaccine's 100% effective, so it requires that critical mass of folks to be vaccinated.
And so when you say we need over 90%, what is the present rate in Rhode Island? Do we know that?
We have very high rates. We have very high rates of childhood vaccination. We've actually received awards in the past for our childhood vaccination rates.
Fantastic.
Unfortunately, the data is lacking in the adult realm, and that's part of the reason why we need this vaccine, vaccine registry. Yeah,
yes.
This vaccine. I mean, this registry would expand our childhood registry to a lifetime registry, which 48 other states already have the authority to do. We're one of 2 states that doesn't, us and Connecticut. So an adult registry, a lifetime registry, would allow us to do that public health surveillance to see where there's low rates of vaccination, target those areas for increased vaccination, and respond in times of outbreak to the lower vaccinated areas.
Good. And one last question: what do you say to people who say that vaccines aren't safe, cause problems, like hurt children or whatever? What do you say to them?
I would say that vaccines have been studied by the medical community and our experts more than many other medical subjects, and it's been proven time and time again to be safe. There are, of course, risks with any medical procedure, but the vaccine adverse reactions are so few and far between, literally 1 in a million cases, where they really pale in comparison to outbreaks that kill hundreds of people, measles, polio, you name it. Vaccines are a miracle of the 21st century,
yeah, sure.
And we can't forget what they've done for us as a society. I think too often folks that weren't around when polio was around, or have seen some of the terrible things that these diseases have caused, don't realize what we're benefiting from.
Right.
And it's up to us as public health agency and our medical providers to keep everyone, our responsibility to make sure that the public is safe.
Very cool. Excellent. Thank you so much.
Thank you.
Really good.
This is really exciting. Thank you all so much. The bill, we put our adult immunization registry bill in last year once we realized that we were lacking something that 48 other states have. Immunization registries are super important to doing the public health work we do at the department, analyzing where there's low rates of vaccination and interjecting and getting us better prepared to respond to outbreaks. As you know, there's been a number of outbreaks across the country recently that reinforces the importance of this kind of public health tool. So it's really something that we're looking to get established here in Rhode Island to protect our citizens. Today's not just about the immunization registry bill. Today's about building support for vaccination, confidence in vaccination, and highlighting to our legislators what an amazing public health tool it has become. It's really, one of the, miracles of the 21st century, and that has allowed us to save millions of lives every year.